Was there a specific moment when you realized private practice could be a meaningful part of your career?
I think so, yeah. So when I first started as a consultant, I think it was really important that I understood how to be a consultant, understood how to operate, understood how to manage the team. And I wanted to spend around a year or so doing that within my NHS practice that was a reasonably safe practice. But then following on from that, I really wanted to look at external things and how I could develop myself as a clinician and develop my private practice separately to that. So after about 12 months or so, I'd say that's when I really started becoming quite interested in private practice. I think my NHS practice is something that, of course, has helped me develop as a clinician, but my private practice allows me a lot more flexibility to try things I wouldn't necessarily do within the NHS, and also to manage patients in a slightly different way and really give patients what they need, I think, as a for a medical consultation, which is what I quite enjoy about private practice. You get a bit more time, and you get to really give the patients what they want.
What were your expectations when you first entered private practice, and how different was the actual reality of it?
That's a really good question, and I think the reason that's a really good question is because when I first entered private practice, I'm not entirely sure what my expectations were. I don't think I had any really. But then on reflection, I think I did have some expectations that I've come to learn a little bit later on. So, for example, when you are in a clinic as a resident doctor, a junior doctor, when you're in a clinic in the NHS as a consultant, your clinic is full to the rafters. You've got patients coming in one after the other, wanting to be seen, on a relatively urgent basis. And I presumed that when I started off as a private consultant, it'd be very similar. But what I actually found is in that first clinic, that first 10 clinics, I was essentially a consultant sat in a room on my own, basically, with only, one or two patients coming in to see me. And the reason behind that is because, the patients don't know who you are. You haven't really built up a reputation at all. So you find yourself starting off really quite slowly before you start to develop a reputation, develop some clinical credibility. But I think that's where you've been really helpful, obviously, to develop that, as a consultant for myself and I know many colleagues as well. So I think that when I started, my expectation was really that you would walk in and all of a sudden you think, I'm a good doctor. I'll have patients come in to see me, but actually, in actual fact, that's not the case. And what you find is the more experienced consultants who've been doing private practice for some time are the ones who've developed a sort of established practice. And it takes some time really to get to that point. And I think it's important as a consultant, you look at all the avenues that can help you in regards to that, to try and develop your practice at an early stage.
Yeah, 100%. Agreed. Are you trying to become known for a particular procedure or niche?
I'd say yes. I primarily am a robotic surgeon. Robotic surgery isn't necessarily that novel anymore. People have been doing robotic surgery for the last 10 to 15 years, and it's reasonably well established within urology. But I primarily operate on kidneys. So I do partial nephrectomies, and treat kidney cancer robotically. So that's sort of my niche, really. Now, I treat sort of general urology as a urologist privately, but I think primarily what I'd like to do is develop my practice to be known for what my specialist area is, because that's really where I can excel above others, really, and that's where I'm most experienced. Now, it's quite difficult to do that because, as I said before, there are many other consultants who are out there who have potentially more established practice, have been consultants for longer, who are more well known within that world. So it's quite a challenging marketplace, really, when you are a relatively new consultant trying to sort of jostle for position. And it's all about visibility, really. You need to be someone who could be seen amongst your peers, and you need to be someone who a patient will choose you above others. So yes, although you might have a specialist practice, the patients need to know about it. And until they know about it, you won't necessarily be seen within private practice, I've found.
I think being a subspecialist does help you get more top of funnel patients, and then they'll stay longer for like your general stuff. So yeah, I completely agree. Awesome. And then the next question is like, when you started, like, who were your first private patients and how did they find you?
So I sort of mentioned this briefly before, that I found that for the first few weeks and months, I was, sat there really keen as a consultant on my own in a room, and there were very few patients coming to see me within that first few weeks and months. And actually, in hindsight, the first few patients that came to see me, I don't think they sought me out because I didn't really have a professional reputation at that point or any obvious visibility. I think that the first patients that came to see me were patients that were just looking for the next available consultant. So, they call up my local hospital and they just say, I need to see a urologist for XYZ, when's your next appointment? And they might say, well, we've got an appointment tomorrow with Mr. Tolofari. And I'll just say, okay, fine, I'll see that guy. And I think that ultimately that's probably how things started off. One thing that I found quite useful was making myself available throughout the course of the week. So offering a few clinics throughout the course of the week, because that means that you are the next available person quite often. And so I found that helped me quite a bit. Now, as your practice develops over time, what I found is that patients then do start seeking you out. And because it may be that your local hospital start recommending you, it may be that other consultant colleagues recommend you, and it may be that local GPs or local consultant colleagues in similar areas start recommending you as well. And at that point, it may be you start developing the practice that patients start seeking you out independently, which is really where you want to get to be.
100%. 100%. And I feel like obviously going through the ropes of our practice, maybe your mindset has changed slightly, if not a little bit at least. And so what was like the hardest mindset shift going from like consultant entrepreneur, basically, any aspect of that, the practice or how you view your career?
Again, I think that's a good question. I think that for me, the biggest sort of mindset shift was that this isn't going to just happen on its own. So I think that, yes, historically, you could argue that if you are a good consultant, I'm sure everyone thinks they're a good consultant, and there are plenty of good consultants out there. But going from a good consultant in the NHS to a very productive and successful consultant in private practice doesn't just happen overnight, and it doesn't always just happen naturally. It may take you 10 or 15 years really to get to the point where you've got enough clinical credibility in private practice and you've got enough recognition in private practice for patients to start seeking you out independently. But if you want to look at getting some improvement in your private practice on a slightly more shorter scale within a couple of years or so, I really think that you need to take ownership of the issue. And by doing that, you need to look at ways and means in which you can make yourself more visible, ways and means in which you can increase your clinical credibility, and ways and means in which you can compete with other colleagues there. As I said, Allied Health Media have been really helpful with this, particularly at improving visibility in that area. So I think the biggest shift for me was going from sitting in a clinic room where I was on my own a lot of the time with relatively few or no patients to then a relatively busy private practice. I think was realizing that I need to do something about this. And unless I do something about this, it's not just going to naturally occur in the short term. So I think that was the biggest sort of shift for me.
Yeah, that's actually really good advice. I think people find it really insightful. And I guess I'm quite interested, kind of on a similar vein. A lot of the doctors I speak to, like I've been like at least I think I average about 6 doctors a day, inquiring about services. And a lot of them are like, I think the mindset is such an important thing. I think that, to be honest, right now, the people approaching us are probably still like maybe 3 to 5% of like the whole market. Like I think things are going to change drastically over the next couple of years. And people are going to realize that like, okay, they need to get more visible if they want that short-term growth. But I guess like, there's the mindset stuff like, oh, maybe like charging and pricing and like thinking themselves in the business. And like, I think they have to overcome these mindset hurdles. I guess what advice would you give to consultants who feel guilty about pricing up their time, if that makes sense? Like, like because they go from like, okay, completely altruistic to like, okay, I'm now running a business and there's going to be some hurdles about like charging for their time, increasing their prices and what kind of stuff. And they'll feel guilty about doing so. I guess general advice would you give for them?
Yeah. And I think this can be quite a challenging phenomenon, really, can't it? From going from NHS, where you have trained for a decade, if not longer, you give up a lot of your time as a registrar. You work essentially for free as a registrar. And you're doing that basically because you are being trained in the field that you've always wanted to do. But when you become a consultant, you run your own specialist practice. You spend your first few years developing that and consolidating that. And then when you move into private practice, I think it's important to remember that these patients are coming to see you for that consolidated expertise that you're offering them. And the patients are willing to pay for that. Now, the work that you do within your NHS practice and your private practice is very much the same in terms of you do the same operations, you treat patients exactly in the same way, but the patients are paying for a certain standard of service, and they're also paying for a certain standard of expertise and expedience really of being seen. And they're happy to do so. They're insured or they're coming to pay you on a sort of a self-pay basis. Now, in terms of people feeling a little bit guilty about that, I think that the service that you offer to patients in the private practice is very different. You may spend half an hour with a patient rather than 10 minutes with a patient. You may be able to operate on a patient within 1 week rather than 6 or 8 months. And that's what the patients are paying for. I think there's a certain expectation for a different service within private practice. And on that basis, it should be treated as such. Now, I can appreciate that for those who aren't used to that, it does feel a bit unnatural at the start. But I think that the patients are expecting a certain service, you're offering a certain service, and therefore you are treating them as a business because you're offering a higher standard of service. So I think that'd be my advice at the outset. But I can appreciate it does feel a bit uncomfortable at the start. And I think it does feel a bit uncomfortable for the majority of people, just because of the history of how you've been trained and how you expect to sort of move forward as a doctor.
Yeah, I love that. I think that, yeah, people actually find that really helpful. So yeah, I think that's really good advice. And so I'm curious to know this as well, because I love understanding problems as well, so I can solve them. But if you could eliminate one admin or operational bottleneck in your private practice, like forever, like what would that be?
So I think that the biggest hurdle to you establishing a good private practice is having a good secretary. So for me, when I first started, we worked in a sort of consortium in a larger group, and I don't quite think that we had our secretarial and admin support quite arranged as well as we could have done. And as a result, we were losing out on patients, losing out on bookings. We had a couple of complaints because patients weren't hearing back as quickly as possible. So the biggest thing you can do is get a good secretary. If you get a secretary that responds to patients really quickly, that chases up inquiries for you, liaises with patients on a regular basis, that liaises with the hospital on a regular basis and other consultants on a regular basis, that in itself could hugely expand your private practice just purely by having a sort of good administrative setup. We've learned that sort of in the hard way, really, from going from a situation that didn't quite work. We went through a few different secretaries and admin support to then now landing in a situation where that is completely under control. And as a result, you can really make sure you get all the opportunities that come your way. I think that's really, really important. And again, that's something that I don't think I realized the importance of when starting, that actually you need to have someone. So yes, you can be there in the clinic room as a consultant, but you need someone who's going to get the patients from the inquiry to the clinic room. That's really, really important. And unless you've got someone who's a good administrative support, you're really going to struggle.
1,000%. I have so many consultants, both people who are considering our services and on our program, who are asking me for like referrals to like third-party receptionists and stuff like that.
Absolutely, yeah.
Biggest brand I'm seeing, and I'm considering like, do I start another company there to service the people who are asking me instead of giving referrals every time? But
yeah.
Okay, amazing. And then the last question is, if you were mentoring like a new consultant just entering private practice, where would you tell them to start? Like, what would you tell them, like, if you were a mentor to them?
Okay. So I think the first thing I would say is I wouldn't consider starting any private practice until you've done at least 12 to 18 months in your NHS practice. That's the first thing. Consolidate what you're doing within your NHS. Make sure you're starting to master, if you're a surgeon, starting to master your operations. Make sure you are very comfortable with seeing outpatients. Make sure you are confident in managing complications. Really make sure you've sort of mastered your practice, really, particularly in a subspecialist area. Some advice I'd say is that actually in private practice, you feel very much as though you are slightly more of a sole trader. You are practicing very much independently. In the NHS, you're still practicing very much in the realms of, as part of a team, really, and there are other people available. Whereas in the private practice, it is slightly different. So I'd say consolidate your NHS practice first, or whatever practice you do, consolidate that first, then consider moving over to private practice. I think feel free to start slowly. As I said, you may be sat in a clinic room and you may be just seeing 1 or 2 patients. That's okay. If your hospital can offer you an NHS contract, for example, just to improve the volume of patients that you're seeing, I would take that within the first year or so, just so you get used to seeing patients in the private hospital. Make sure you establish early good secretarial support. So get a good secretary, not necessarily your secretary who's in the NHS who you get on with. It may be that they don't have time to actually support your private practice. So try and find someone who's external, who's going to be able to support your private practice properly at the outset. I then say, once you've got established within the hospital, I then say, go and speak to some local GPs, go do some local GP talks, establish yourself within that local area so GPs can start referring to you. And there are also a number of sort of private GP setups now as well. So you could approach them to look at establishing yourself with them to increase your referral stream. I then think following on from that, then look at a way that you can start marketing yourself and improving your visibility. So I'd look at it sort of stages, really. So I think stage 1 would be establish your practice. Stage 2 would be get set up at your local hospital and look at a way that you can improve your volume. Stage 3 would be establish yourself with some local referrers. And then stage 4 would be look at ways that you can market yourself. For example, as I said, allied health media have been hugely helpful for me in terms of improving my visibility. And that's after a couple of years of private practice. So I'd say that would be sort of stage 4. I think stage 5 would be find whatever your niche is. So I think that I work with some colleagues in urology. They're sort of female urologists, and they're the only female urologists within our area. And actually, they've got a hugely successful private practice because women want to go and see other women, for example, in that scenario, and they're the only women in the area. So all of a sudden, their private practice has just exploded. I think that that's really important. Find your niche. If you've got a niche, look at that niche and look at the way you can develop that. And I'm sure everyone, will have that to a certain degree. So that'd be sort of my sort of 5-stage plan, as it were, to try and develop your private practice. I think the caveat to all that would be just be patient. As I said, you'll be used to NHS practice where your clinics will be bursting at the rafters. That won't happen in private practice initially. It just takes a bit of time to get that set up and to establish yourself, really.
Yeah, I think that is like the perfect play-by-play scenario. Like a lot of people are like, oh, where do I start? What are the steps? So I think that'll be amazing.